I would like to start this discussion by presenting the drug sildenafil. Sildenafil is categorized as a phosphodiesterase type 5 inhibitor. Phosphodiesterase type 5 is an enzyme which binds to and essentially destroys cGMP. Sildenafil inhibits this process. The preservation of cGMP causes smooth muscle tissues to relax, resulting in vasodilation. Vasodilation is the dilation or opening of blood vessels. So how does this drug relate to sociology? For those who are familiar with drug properties, you may be able to identify the trade name and primary indication of sildenafil. Were you able to figure it out? The generic drug sildenafil is most famously known as Viagra and used to treat erectile dysfunction. However, sildenafil may also go by the generic name Revatio, whose vasodilating properties are used to treat pulmonary arterial hypertension. You likely have not heard of Revatio. That is, unless you suffer from PAH or you're just really well versed in pharmacology. Still, it is more common to associate sildenafil with Viagra and erectile dysfunction than treatment for pulmonary arterial hypertension. Viagra, Revatio, whatever you call it, sildenafil is still sildenafil. So what does this multi-purpose drug look like? Moreover, how is it marketed? A Google search further reveals an overwhelming number of Viagra advertisements and none for Revatio. Note that no trade names were used in this search, but sildenafil was primarily represented in the form of Viagra. But it does not end there. Sildenafil is not the only drug with multiple indications and trade names. Furthermore, it is not the only drug used to treat erectile dysfunction. There is a huge industry for erectile dysfunction medication and a huge amount of trade names and generic names for each drug. Two of the most popular medications used to treat erectile dysfunction are Viagra and Cialis, generically known as sildenafil and tadalafil. In 2013, Viagra was ranked 42 among 100 of the most sold drugs in the United States. Cialis was ranked 48 on the same list. Both of these drugs are well marketed and presented in similar ways. As you can see, the ad for Viagra shows a sultry blonde woman resting on a bed with her hair blowing in the wind. Cialis shows a man and a woman, assumed to be a couple, lounging in bathtubs admiring the sunset. Both advertisements are simple. Although the type of sexual behavior is not explicitly stated, both ads suggest that sexual behavior is gonna take place. The Cialis ad clearly depicts a heterosexual monogamous couple. The pose of the woman and the use of the word gentleman similarly suggests this in the Viagra ad. Video advertisements allow for deeper views of how Viagra culture reinforces the gender binary, heteronormativity, and roles of men and women in intimate relationships. It is important to note that Viagra culture does not just involve Viagra. It encompasses all medications that help treat erectile dysfunction. In the following videos, Ellen DeGeneres will shed light on some of the important information that is missing from these advertisements.
The thing about the Cialis commercials is they show couples doing activities together and the husband gets in the mood. Some of the activities are normal. Tennis, you see the tennis, and then he hits her on her butt, It's the beginning of knowing he's in the mood when it goes. Then there's random activities like, have you seen the painting the bench? They're pretending to paint a bench. There's nothing on the brush. And he's really turned on by that. Take a look.
You make a great team. It's been that way since the day you met. But your erectile dysfunction, it could be a question of blood flow. Cialis tadalafil for daily use helps you be ready anytime the moment's right. You can be more confident in your ability to be ready.
Here's the commercial that I made for them.
Hello, men. It's me, Ellen DeGeneres. Listen, I'll be honest with you. I don't have an accent. And when it comes to your downstairs area, I don't know how any of it works, and frankly, I don't care. But I know when you can't wake up Sleepy Joe, it's a nightmare. It's nothing to be ashamed of. Plenty of men can't get their noodles al dente. So, if your soldier won't salute, then Viagra is for you. Sure, there's lots of problems in the world, crime, the economy, global warming, but this is important. We need to fix your... All you need is one of these little blue pills. I fell off the bed. But I have to warn you, if you have dizziness, difficulty sleeping, or if your cobra remains charmed for more than 4 hours, please see a doctor. So if you think Viagra is right for you, talk to your doctor or your healthcare provider. Just don't talk to me about it. Yucky.
These advertisements do a wonderful job of sending messages of stigmatization to viewers. Unfortunately, they are also missing very valuable information, and information is education. To be fair, not all advertisements are the same. Some provide more information than others. Tadalafil is most commonly known as Cialis. As we have seen in the advertisements, Cialis is primarily used to treat erectile dysfunction, but when exploring the Cialis website, it is made apparent that Cialis also treats benign prostatic hyperplasia, and it can treat this disorder alongside treatment of erectile dysfunction. This medication is used for multiple purposes, but BPH treatment remains underrepresented in advertising. Adcirca is also a form of tadalafil, used as a once-daily treatment for pulmonary arterial hypertension, specifically in women. The website for this medication mentions nothing of erectile dysfunction or sexuality. Although this use of tadalafil is the same exact drug as Cialis, it goes completely unacknowledged on the Cialis website. Vardenafil, commonly known as Levitra, is also used to treat erectile dysfunction, but is marketed uniquely from Cialis and Viagra. On the Levitra website, there is more information and emphasis on knowledge and education than sexuality. Unfortunately, Levitra is not as commonly used as Viagra and Cialis, and Levitra advertisements are less prevalent in mainstream media. What does Levitra tell us that Viagra and Cialis don't? The generic name is clearly stated with the trade name. In Viagra and Cialis advertisements, it is not as explicitly indicated. Levitra is also more candid in explaining how it works to treat erectile dysfunction. Due to the objectification and over-sexualization of Viagra and Cialis advertisements, there is little time nor space for advertisers to inform users of how the drug works on the body. A common misconception is that it provides instant erections. This is not true. Erectile dysfunction drugs do not raise arousal or increase libido. Simply vasodilation allows for blood to more easily enter the penis, causing an erection. However, it is still necessary for arousal and stimulation to occur for the erection to take place. As stated earlier, alternative uses of the drugs are not mentioned. Companies market the drug as being unique treatment for a single disorder, rather than taking a more versatile approach. Moreover, those who struggle with alternate problems may be unaware of drug options that could help them. Tying this all back to sociology, why are these things a problem? The way that these drugs are marketed is stigmatizing. In our culture, erectile dysfunction is viewed negatively. Men that have difficulty obtaining and sustaining an erection are considered weak and unmanly. They do not have the power to please women sexually. They are second-class citizens. Furthermore, they are typically considered to be old men. However, 5% of erectile dysfunction cases are men that are between 20 and 40 years old. This is a small percentage, but it is important to acknowledge that young men can and do struggle with erectile dysfunction. Since younger men are not portrayed in advertisements, society has made it more difficult, culturally, medically, and psychologically, for these young men to deal with erectile dysfunction and obtain treatment. Most all advertisements seem to involve heterosexual relationships, a man and a woman, with the goal of performing vaginal intercourse. However, the woman's pleasure in these encounters is under discussed. Furthermore, heterosexual men are not the only ones that are in need of medical assistance. Gay men are just as vulnerable to erectile dysfunction as straight men are. But this demographic is underrepresented in Viagra culture as a result of how the medications are advertised. These men may feel uncomfortable or unable to take erectile dysfunction medication because of its heterosexual stigma. This is also a disadvantage to the companies, as they fail to resonate with potential customers. Within the same scope of relationships, these advertisements also enforce ideas of monogamy, excluding potential customers who may be polyamorous. In conclusion, the way that erectile dysfunction medications are advertised affects our society, and society affects the way that they are advertised. As we progress as a society, these advertising techniques force us to take steps backwards. They are exclusive to older male monogamous heterosexual consumers. If advertising changes were made, these drugs could reach a larger range of customers. In turn, this would help the drug companies and end the negative stigma of erectile dysfunction and erectile dysfunction medication. Erectile dysfunction is more common and affects a more diverse population of people than portrayed in mainstream culture.